Welcome. This is, we have the honor of being one of the first panels at South by Southwest, so welcome to South by Southwest 2018. My name is Thomas Goetz. I am a writer and entrepreneur and dilettante in health. We are doing a panel today that I think is a good way to start South by Southwest. It's a remarkable panel. I'll just introduce people first. Immediately to my left is Karen DeSalvo. Karen is a physician, which is important. She was formerly the Acting Assistant Secretary for Health at the Department of Health and Human Services. And she was also the National Coordinator for Health IT. And for a while, you did both of those at once, which is two very hard jobs. And presently, you just took a role at the Dell Medical School here in Austin. So Karen is representing, well, all sorts of things that we'll get into. Next to her left is Nick Chim. Nick is an aeronautical engineer and entrepreneur. He is also, was formerly the co-founder of Flux, a Google X company that created software for engineers and designers. And he is presently at Sidewalk, Alphabet's or Google Alphabet's Sidewalk, which we'll hear about, and he runs the model lab there. And finally, at the very end of the panel, we have Ryan Panchadsaram. Oh, God.
You said it so good before.
I did it.
I feel like they make these this big for me.
Ryan Panchadsaram. Ryan is the former Deputy Chief Technology Officer at the White House. He did some amazing things at the White House, including was part of the rescue team behind healthcare.gov. You were on the cover of Time magazine for that, right?
That was fun.
And he was also an entrepreneur in healthcare, or has been an entrepreneur, and started a company through the Rock Health incubator several years ago. He is now a partner at Kleiner Perkins in San Francisco and advisor to John Doerr directly. So each of these folks is bringing some remarkable perspective, and I think we're going to get into it. To begin with, I wanted to set up what we're talking about. The basic question we wanted to explore here was, or is, why are we making ourselves so sick? Why have we designed a infrastructure, a society that in some ways is almost exquisitely designed to lead to ill health? When you think about the food we eat, the ways we get around, the roads we pave, the games we play, all of these have, in essence, a net impact of poor health. And there's a reason why those are engineered that way. They feel good, but they don't actually make us be good. They don't make us healthy. So I would ask, or we are here to ask, why shouldn't the default be health? Why shouldn't the default of daily life lead to better health? This is not a small proposal or a small idea. It would take a huge shift in the way we think about our food, the way we think about our cities, the way we think about our communities. But we think that we are at a point where we can make these things happen. And this idea is one that you can read about in depth. Steve Downs from the Robert Wood Johnson Foundation has written about this idea on tincture, so feel free to explore it in a little more granular detail there. And this is an idea that has actually been around in many ways. In public health, we talk about the social determinants of health. When we think about lifestyle diseases, we're talking about this kind of cycle. Daniel Lieberman, the evolutionary biologist, calls these mismatch diseases, where our bodies are not suited to the lives that we lead on a daily basis. So what does it take? If that's the problem, what does it take to change things? That's what I want to get to, because each of these individuals is actually part of the vanguard that is helping to change them. And we hope in the course of today to bring you into the fold and to make you part of that vanguard as well. So we want to put forth to each of you the idea that we should not be satisfied with salad bars and McDonald's. We should demand more, and we should be part of the change that needs to come.
Although they did flip the arches.
For women's, yes, for International Women's Day. Again, radical shifts. So let's get started. What I wanted to do was just go down the road to start and have each of them talk about what they've been doing in their careers and lately through this prism of changing the very infrastructure of health or of life. Karen, do you want to kick us off?
Great, thank you. It's really wonderful to be here, and I'm looking forward to not only sharing my story and our stories, but hearing from you guys. We were saying that we're looking forward to hearing what's on your minds. You know, in the context of this, the health versus sickness model and the structure that we've created in the country, we have designed a system that's perfectly created to get the outcomes that we have. And having been a doctor practicing in New Orleans, I can tell you that system was exquisitely designed to generate poor health. I spent the early part of my career doing a lot of picking up the pieces for my patients, and quite a bit of what was their barrier to their own wellness wasn't that they weren't motivated or interested. It was that they had so many other challenges in their life, whether it was financial or transportation or housing. And so I was doing, as a doctor, a lot of social work, which I was not skilled at doing and not trained at, but we were always trying to kind of rejigger the healthcare system that we were working in to better meet people where they were and help them with the challenges that were a higher priority for them than, frankly, their medical conditions. And I think the cataclysm that gave us not only the disaster but the opportunity was Hurricane Katrina, because we would have been doing a lot of tinkering had it not been for the devastation of our entire society, much less our healthcare system and our public health infrastructure in New Orleans in 2005. And as we stood on the street thinking about how to build back our health system, we were very deliberate about not wanting to recreate what we had, which had been a very sickness model, driving people to the emergency room, picking up the pieces after they were already sick, but really try to move further upstream so that we would have an opportunity not only from a medical standpoint, but really create a healthier context in the city of New Orleans. The reality was that early, much of our attention was on that upstream preventive care, primary care focus. Though, and I think, honestly, I thought we would be able to do a lot with neighborhood-based clinics and partnerships with those clinics with community organizations and faith-based organizations in the business sector. And though we could do a lot, farmers markets in our parking lot and being out in community with people, encouraging physical activity, there's only so far the healthcare system can go. And it became really clear to me that truly to create the conditions of health for my patients, for our community, that I'd have to really understand how all the sectors came together and made decisions, and that I thought public health had a really critical role to play as a part of that, as a neutral convener, as the only entity in a community truly accountable to everybody who lives, learns, works, and plays there. And so that drove me to become health commissioner for New Orleans. And we set on a journey to build up what we'd done in the healthcare system, but move further upstream and really begin to work with transportation and urban planning and all the other sectors that can help make the healthy choice the easy choice, to create a New Orleans in which there was more green space, more bikeability, more public safety, more parks and playgrounds, not just programming there, but really just the feel of the space, better housing. And I'll just give you one dot on the map about a choice that our community has made in just these short 13 years. We made this about 4 years ago, was to go from being one of the unhealthiest places on the planet to choosing to go smoke-free, which people still are shocked at when I tell them that about New Orleans. But that's how far the culture of health has changed in our community, where we've begun to recognize that we have to change every context so that we can not only change the numbers, but give people a better life. And I carried all of those stories and that journey with me about health and the creating the right, not only clinical excellence model, but really a public health infrastructure with me to HHS. And two big things that I want to point out there, maybe three. One is the thinking about where the Medicaid and Medicare program are. I'm sorry to go back to healthcare, but I remember so vividly after Katrina that we asked the Medicare program to help us think about literally building sidewalks, basically creating a healthy community. And they laughed and said, that's ridiculous. We do beds, we do hospitals, we don't do health. Now, some 13 years later, there's an active program in the field that Medicare developed and is piloting to do just that, to address the social determinants of health. Not so much create healthy sidewalks, but there's been a pretty big shift in one of our big payers. And I was happy to be able to have been a part of that. We also have a big change in that we now have all this rich information about people's lives and our communities, and we're learning to use that information to improve health and to connect with people. And so the technology journey is just beginning, I think, as we're learning how to leverage that to empower people and communities and help guide and coach people all along the way. I think our biggest opportunity still that we haven't sorted out is the business model for it, and I think that's what's exciting about what these guys are going to talk about. You know, we might know how to do it. I've seen communities across this country that are creating conditions in which everyone can be healthy, but most of it is project-based and one-off, or just led by, you know, sheer will of people after a disaster like Katrina. But to really embed it into the operating system, I think we need a really tight business model that's going to support health, and that's what we're hoping we're going to be able to learn more about, frankly, here at DelMed. So thank you.
Great, thank you. Nick?
Yeah, I think this question of default is something that we spend a lot of time thinking about at Sidewalk Labs. So much of the choices we have available are dependent on the physical infrastructure that we have available. And so at Sidewalk Labs, our ambition is to create a living laboratory where we can understand how we can design better cities so that they are more equitable and can improve people's quality of life. And health is one of the key determinants of quality of life. So we spend a lot of time thinking about the factors that affect people's health, so including, you know, how active is your lifestyle, availability of different services, could be health services, could be food services, and thinking about how to make all of those choices more available and more affordable. And during the course of 2018, as some of you guys might know, we are in the process of planning a district that is going to be built from the infrastructure all the way up to the services, to think about how we can create sort of the conditions to run a lot of the experiments so we can create better default and healthy infrastructure. So I'm excited to participate in this panel and looking forward to the conversation.
Great. Mr. Panchadsaram.
Perfect. So defaults are incredibly powerful, right? Culture creates defaults through the actions it influences and makes us do. Companies, I think, create defaults as well through the products and services that they build. At Kleiner Perkins, we invest in the disruptive, and we've had a fortunate history where healthcare has been a big part of where we invest. One of the first companies that came out of Kleiner Perkins was Genentech, and one of the more recent companies that we've invested in is Peloton. Right? Both are truly healthcare companies, one through therapeutics, but the other through encouraging us to be healthier every day by hopping on a bicycle in the middle of your garage and, you know, taking a class that pushes you to your limits. And so I'm excited to be part of this conversation because I truly believe that companies, it's almost the responsibility of companies and the future ones that we all create to kind of create defaults that help us eat better, live better, move better, and just do things better that results in kind of the world that we want to create. And so all the levers here that we have at the table, I think, are going to lead to a pretty interesting conversation. So Thomas, I'll toss it back to you.
Cool. So I think each of you mentioned a word that I think is fundamental to the scale of what is necessary and where we're trying to put the problem. The word being infrastructure. Mm-hmm. I'm curious how each of you thinks about infrastructure as it relates to health. I mean, obviously there's the built environment and there's the impact of that, but how, given the scale of infrastructure, for two questions, how do you think about infrastructure, and two, how do we start to change it?
Sure. So I think there's two big parts from Sidewalk Labs' perspective, thinking from a planning perspective. One is land use. So how do you decide where to place things in a city or in a neighborhood? So do you have separated work areas and resident areas and shopping areas, or do you create more mixed use and human scale districts? So that's thinking about how do you organize the space and how people move around in space. And then you think about circulation. So circulation is not just access, but potentially active modes of movement. And so providing as many options and choices that are healthy and active. And then specifically in Toronto, we also have to think about weather, because you can't just think, Austin's a great place, and I live in San Francisco, and it feels like it's the same day every year. But in other places around the world, we also have to consider the annual cycle to make sure there's healthy options throughout. And these are really, really critical things to get right, because once they're in place, they're very difficult to change. So how difficult is it to put in a subway line when there isn't already one? And so as we're thinking about planning new districts, getting these initial conditions and understanding growth patterns and making these good choices for the future communities are critically important.
It's one of my favorite topics, but I'm going to pick a couple of examples. And I just want to say, for maybe the highest level, that we don't pay enough attention to infrastructure, because probably a lot of our function follows our form. And one of the best examples about, I think, how infrastructure affects health is a disease example. So in tuberculosis, which used to be a leading cause of death in the U.S., we gained ground in the epidemic spread of tuberculosis through housing policy, by creating better spacing in tenements and creating better airflow, air quality, and it did more than drugs did, basically, to impact tuberculosis. So just even in something that we would consider an infectious disease where we have a therapeutic, we forget how powerful infrastructure can be. It affects mental health, physical health, but there's also, I think, what you see is the built infrastructure, and what I hope that Nick and them are also considering is, as you mentioned it, land use. There's a broader set of other policies, whether that's about smoking or about speed limits or access to seatbelts, sort of this broader idea that when you're using the infrastructure, that there are also ways that we can help people be more safe.
When I hear the word infrastructure, I think of like the foundation, right? And so you have like the regulatory foundations, you have the physical foundations of the cities and how they're planned, and from like maybe the company context, it's how does the organization that you build, how does it sustain and scale and thrive, right? I mean, healthcare is really difficult because who pays for healthcare is a really big question. And when you think of a company you're trying to build, for it to scale and thrive, you need to find those sources. And kind of the neat part about this conversation is we're looking a little bit outside of healthcare through other means, right? The food that we eat, the places that we live, how we transit, and the things that we do. But if you're focused on the healthcare side of things, it's kind of this complicated box, because most of healthcare is paid for by the federal government, right? I think it's Medicare, Medicaid cover more than half of the country, and then employers cover the next big chunk, and then truly there's just a small slice of people that buy health insurance themselves on healthcare.gov, the marketplace. And so knowing who kind of the foundational piece of how do these ideas that we want to come to be get paid for is a really important thing just to talk about and think about, because I think when you kind of talk about it up front, you have a better chance of cracking the nut and solving the problem.
I'll give you an example, actually, also from a community I visited in East Tennessee, a little rural community where they were thinking about infrastructure as a means to improve health. Y'all should go visit them. This is Johnson City. Anybody from Johnson City? They decided as a community, looking at the data, that they had a problem with obesity and cardiovascular disease, and so they made a choice that they were going to make change, and they did a whole bunch of things, programmatic and structural. And they told me this story about how the Streetworks people had to dig up, had to do some digging, basically, to lay some new line. And when they paved it back over, they decided on their own to make it a walking path. And no one instructed them. They didn't have a grant. They didn't, it wasn't the health department. It was just they knew that that would be the right thing to do, is to sort of begin to change every bit of infrastructure that they could and be empowered. And when I hear stories like that, it gets me excited about communities taking action upon themselves to create a healthy environment, to make the default choice sort of the healthy choice. But it also means it's a part of, I'm going to use your language, their operating system. It's the way they're thinking about moving forward, and they're not going to go back to just business as usual. It's exciting, and there's lots of great bright spots like that around the country. The question is, how do you make that, and I hate to keep saying business model, but how do you make that meaningful in a way that it is mainstream and not just great bright spots?
We're going to get to that.
Okay.
I just want to kind of frame the problem a little more, because I'm glad you mentioned TB and the scale of that challenge, because it really did involve tearing down entire neighborhoods and rebuilding the structures of daily life. And I think that's the scale of what we're trying to propose or trying to get people to think about. But also you mentioned, actually Nick mentioned choices, and I think there's another kind of level on which we're thinking about this, is the choices that we create for people and that people create for themselves, as you mentioned with Tennessee. How much of this, or how much of this does it come down to personal choices, and are we up against the impossible will of the human being there, and how do we work with people in terms of making those choices? I mean, everybody talks about healthy choice being the better, or the easy choice being the healthy choice, but what does that actually mean? Do we have examples of that?
I think one example that comes to mind, I mean, choice is so important, right? Like, it can't be a top-down force that you must eat good food and do certain things.
Right.
And so, like, one company that comes to mind that we're really close with is a company called Beyond Meat, right? They create alternative proteins like burgers and sausages, everything, but made out of plant protein. And the challenge for that company is, how do you make it so tasty that you choose it as the default, right? Not that, okay, fine, today's the healthy Friday, or healthy, usually Friday's not the healthy day, healthy Monday or Tuesday, something earlier in the week. One of the things that company did a little bit early on is in their product that went into the freezer, they knew that the taste is improved in the latest version, but if you rewind back to the one that I think was called the Beast Burger, in order to make it attractive, they figured, well, it's got to have more protein than a traditional burger. We've got to maybe put some more vitamins and minerals into it, and so it actually is a competitive, it's a true competition. So, yeah, this is kind of the one idea that.
Nick, how do you think about choices?
So I spend a lot of time in our work to think about transportation choices. If you look at how our cities are organized, we have a lot of roads. And so I think there were some recent studies that showed, if you did a satellite view of cities and how much land area was dedicated to roads and car infrastructure, it's like anywhere between 40 to 60%, depending on where you are. And so we're very, very good at building subdivisions and connecting them through highways. And really, what's the choice of transportation for those people, right? It's only to drive. And when you need to drive, if you have to drive everywhere, you have to have a place to park it everywhere. So everyone needs a 2-car garage, and then everyone needs a place to park it on the other end. And so all this is incredibly expensive, and depending on how you think about it, could be wasteful use of very valuable urban lands. And so some of the modeling work that our team does is really looking at almost at the individual level, individual household level, to see what choices are there. So where do they need to go? So where do they work? Where do they recreate? Where do they shop? Where do they socialize? What choices are available? Do they have public transit available? Are there safe and accessible bike paths that they could decide to ride a bike on a nice day? So, and then we use this data to give to policymakers to hopefully improve the infrastructure and provide more choices. And I think the way to get ourselves, out of the situation we're in right now, we have to think about how to make more choices available and make them economically feasible and competitive, and eventually supplant the default. But suburbs are difficult because structurally, in a way, we're kind of locked in. And sort of back to my earlier comment earlier, the land use is so critical, because if we get the land use patterns wrong, it's very, very expensive to fix because everything is so geographically dispersed. So I just want to add one more comment just from the term default is super interesting, because having been worked in designing software, we spent an enormous amount of time deciding what the defaults are. And we know from user studies that like 80–90% of people just simply accept the defaults. And so I think this is kind of a tech plus health panel. I think it should, everyone's, as a designer, as an engineer, as a product person, every time you have to like set a default, you're essentially making a choice for users, and that probably is going to be the 80 or 90% case. So something for us to always think about. We have to have choices, and we have to set our defaults very wisely.
Yeah, I actually had a quick question for the group. I mean, how many people out here actually tried, an Impossible Burger, an alternative meat, a Boca, Morningstar? And if you could keep your hands up for just 1 second.
Wow.
And how many of you enjoy the taste? And then how many of you prefer it? Cool. Okay. So we got the enjoy bar. The prefer bar is still more work to go.
Maybe it's a price issue.
It is, yeah.
How many of you took the escalator when you came up to this room today?
There was only an escalator. I was
Thank
looking
you
for the
very much.
stairs.
Which gets into design. And we, just to your point, even in so many buildings and places that we are, the default is the unhealthy choice. So we have to make a lot of structural changes to our existing infrastructure. The opportunity as we're doing new infrastructure. I think that two things are going to be important. One, I have zero idea how to do, but we'll get to it. The first is about technology, and I know this won't be true for everybody, but I do believe that we're emerging into a world where you can have a coach with you all the time, and you can model that coach, and it can learn about you and know how to nudge and direct you, give you directions to the stairwell that are going to be unlocked. There's going to be so many ways that people who understand how to write software and attach devices to us are going to be able to coach and guide. And I'll tell you, as a doctor, it's a wonderful thing, because I want that on my team. I want to have as part of my primary care team artificial intelligence or devices that are going to help make sure that my patients can stay healthy and be, or regain health. And I can't do that with them. I'm not with them 99% of the time, even if they have chronic disease. And I think it gets to be even more interesting if we think about how technology can, through pricing or other preferences, guide people with diabetes to have discounted groceries that are a better health for them, and the drone delivers it to their doorstep for them, so that there's also less of a barrier of receiving it. And that's a world in which people are experimenting already. So I do think, as long as we're considering equity in this equation, we should be leveraging technology a lot more smartly. There are also privacy issues, not just equity issues, and so it's worthy of having a good discussion. But considering the state of health in this country and how hard it is for the default to be to be the healthy choice, I think we need all the friends that we can get. I think the culture piece, though, has something to do with peer-to-peer support, peer-to-peer pressure, role modeling. It's a mix of inputs. In New York City, who's from New York? Gotta be somebody from New York here, okay. So you all have been tackling the childhood obesity epidemic, and everyone's been looking to see what Bloomberg and Frieden and Farley did. That was so brilliant. And what's interesting when they look at their own data, they see that, for example, even the programmatic stuff that they engaged in, which was powerful and important to try to make the healthy choice the easy choice, it happened after the decline in childhood obesity rates started, and actually more closely follows Google searches around childhood obesity. So some kind of a cultural shift where people got more interested in understanding it and wanted to be more empowered and make better choices. So there's something that the community, we haven't been able to figure out what people are trying to tell us about how they make a turn, how we make a turn as a community, that suddenly being healthy is the cool thing. And I'll go back to New Orleans about this. I'm astounded at my city. I grew up in Austin, so health was always a priority here. In New Orleans, not. But it's really evolved, and to the point of, say, even 5 years ago, I went to eat at one of our favorite, totally unhealthy places, Mandina's, that had on their chalkboard, now serving brown rice. And I asked the manager about it, and what's that about? He said, well, people keep asking for brown rice. And so we're starting to have it, and we're going to eventually, and now it's actually on the menu. And these things, they take generations, but if we're patient, maybe hopefully not generations, I think the community's going to start to pull, is what I'm saying. There's some pushing that we need to do and some nudging, but there's a pull that we're all just going to have to demand that kind of a health service, that kind of health support, health infrastructure, and I don't think it can be pushed down on people, because I think they'll just resist.
So you've each mentioned technology, and I think technology is one of the core, I think, premises of this notion is that technology is part of the solution. That we have to be, we can't just rely on public health departments to take this on. We need to tap into entrepreneurs and businesses and use technology, digital technologies, to push this forward. I do note that a lot of digital technology is actually part of the problem. I think Tristan Harris has done some great work on this, but looking at how, especially when we think about one of the big factors for health is community, just connections. How much of things that call themselves social networks actually have the impact of making us antisocial. Nick, you've done some cool, maybe not you, but Sidewalk has done some cool things. I forget the name of it, the app that you guys did on a Chicago...
Parttime? Yeah.
Parttime. Can you explain Parttime?
Sure. So
I love
Parttime...
this idea.
Yeah, so Parttime was an experiment, social experiment we ran in Chicago. And so the idea is, how do you get neighbors to get to know each other? And so we...
What? Say it again?
Oh, Parttime. Parktime. So it's not parking the car, it's like hanging out at the park. So just to be clear. So you go to the park and you have kids, and the parents don't really interact, they're just focused on their kids, but you sense as a community, and you want to be able to have a way to approach people and strike up a conversation and get to know people better. And so this was an app that allows people to sort of register the entire neighborhood, and every time either you're at the park and someone else sees, oh, so-and-so, someone I'd like to meet or someone I know is at the park, you would want to go to the park. Or if you happen to be at the park, you can kind of use your app and discover people that you might want to meet. And so I think, to Karen's point, a lot of behavior change is really the community and the social aspects of it. And so anytime you could use technology and sort of mechanisms to bring people together and motivate them to do something that's active and healthy, I think is a good tool, a good device, and so we did that in Chicago for a little bit, and then because we're shifting our focus to Toronto, we're starting a Toronto similar version of it. So we'll see how that goes.
Are there other examples that any of you have front of mind about how technology can be a positive force for this? It doesn't have to be a consumer technology. I mean, you've done healthcare IT. Like, those are not consumer technologies at all, but they still have an impact on health.
Well, they are consumer. I think where we made the mistake early on in health information technology is thinking that it was for the healthcare system.
Right.
And
billing systems.
That's right. And compliance and regs and creating, all that siloed, blocked off data. And by addressing data blocking and requiring open source APIs on the electronic health records, now we're at the beginning of a revolution because it's about the data, which I think we all get intuitively, but it's about also how we can now leverage that data to the benefit of people's health and communities' health. So Apple's movement to aggregate people's electronic health records from disparate systems and disparate electronic health records is a step forward. It's a game changer, as I've said, though it's the very beginning. I mean, we're going to get to a place where it's going to be, I think, a lot more nimble, but that data alone is about your health care. It's not about your health. And the real opportunity is in a set of companies and thinkers who are trying to learn how to take the best of what we do in, say, the retail sector, and merge that with public health and healthcare, and think about telling, again, a longitudinal story of somebody's health, and all stacked together that tells you a story about a community defined in almost any way you want. There's a couple of companies, one called Carrot Health and one called Socially Determined, that are trying to do this, creating a business case about creating a social risk. So that's more of a deficit model, but and then figuring out how we fill those gaps. But even doing it in a more, I would call it clunky, like survey methodology way, there's plenty of healthcare organizations and public health organizations that are already doing this to be able to target resources and showing return on investment. So whether that's a big healthcare system like a Kaiser, and don't think of it just as healthcare, by the way, with Kaiser, they're doing a lot of community work and partnering really tightly with public health, or communities like Lawrence Douglas County in Kansas that is working with the academic institution and the hospitals, focusing on opioids, but building really a broad database that tells not just a healthcare story, but really a health story and understands housing. I think we're just learning, honestly, Thomas, about how to do this really well. When I say this, I mean with respect for privacy, pull together people's data and use that to tell a real-time story about the public's health and be able to target interventions to improve the health of communities and people. But I also, though, think that we're learning more about how to be respectful of data sources that are not from a traditional health frame. And you've heard a lot about it here. We are maybe arrogant in healthcare about the value of understanding how people are biking through a system, or if there are safe parks and green spaces, and if they're using them or not, because at the end of the day, that's got more impact on their health than how well I treat their diabetes. So there's also a culture shift that's happening in healthcare to be respectful of other information as perhaps more valuable to understanding about health. And public health would have known that for a long time, but is also, I think, reawakening to the opportunity of partnering with multiple sectors to really get a broader picture.
Nick?
Yeah, I was just going to add to that. I think data is super important because, especially, data is so prevalent right now, and it has a much higher sampling rate because everyone has, digital records, and understanding how to use the data properly, and all the new techniques around machine learning and better understanding of how to protect users' privacy provides a whole new lens in terms of how to understand people's lifestyles. And then we do this longitudinally, so it's not like, whenever you visit the doctor, it's all the periods in between. And I think there's significant opportunities to look at that data and use that data. So for our work at Sidewalk Labs, we're building a regional scale model. So in Toronto, it would be like 9 million people, and we're like literally simulating every single day of their lives, understanding all of their needs to like go to work and childcare and like going shopping, and how they make choices and how they travel, so we could compute how many miles they bike or walk or take the bus on a given week. And then we use this to understand which neighborhoods are underserved and study how policy might actually increase the number of choices. So, and all of this feeds into public health, it feeds into healthy lifestyles, and these are all the other sort of long-term effects that influence our health, but it's not data derived from the healthcare system. And so I think the augmentation of these two or others data sources, I think, gives us a totally new approach to addressing some of these problems.
My two favorite consumer examples are, my first one is Pokemon Go. Right, traditionally technology has connected us, but like multiplayer games online, yet you're playing online behind either your phone or a computer. But Pokemon Go pushed people out into the real world, right? There was this little kind of an informal study done by Cardiogram, and they looked at their users pre and post the Pokemon Go launch, and I think they had like 30% of the users were active, and then the launch and the week after, it was like 50% of them were. It's almost a serendipitous example. Like, everyone loves Pokemon, that's why you downloaded it, but the byproduct of it was having people move in the real world and actually physically get active. But I'm sure you all might have seen these examples too, when you saw people on the street kind of, or even when you play, how many played the game? I clearly played it for like a good month or two. You're going around looking for something, and it actually ends up being a social experience because you see a group of 3 over there, you're like, something has got to be over there because they look like this and they got their battery pack plugged in. So one example of a consumer tech, but the one that's even or as exciting or even more exciting is the one that Karen talked about with Apple, right? Their emphasis on this watch, right? The first version that came out was this communication device that let you do a lot of like communication, and it didn't really work. And in V2 and 3, they completely changed the UI for the Apple Watch to be all about health. And now it gives you nudges to stand up. I bet it's giving me a nudge right now to do something. Stand up if you're moving around enough as well too. And their Apple, as well as Cardiogram as a company, is always tracking your heart rate to see if there's some cases of there's just all this magic that I hope happens from this kind of device. And Apple, being a company that values privacy, gives me a little bit of hope that they may be the one that does it in a very good way. Their current approach, if you saw the announcement a month ago around electronic health records, starts to marry the physical me with hopefully my health record me, which then means physicians can see both and appreciate both the clinical side of Ryan, but also the health and wellness side of me.
So, the Pokemon Go example, so everybody, the only concern I had about that was that it was a one-hit wonder. But it turns out that the same company, Niantic Labs, is behind this app that my kids have been bugging me to get, or that they heard about, which is a Harry Potter app that does the same idea.
Yeah.
So it's actually, it's no
Causes
longer...
people to walk off cliffs.
Well, maybe not that. Hopefully not, given that it's my children. But one thing I want to put back to you, Ryan, is so what incentives, and this goes to Karen's point about business models at the beginning, what incentives exist now or should exist for entrepreneurs? Because, I mean, you see this every day, you see people walking in. Are they asking these questions? Are they thinking about, I mean, these are change the world questions, but are they on the dashboard or the...
I think the incentives that are put in front of entrepreneurs now is, I think this holds true in healthcare, but also outside. If you're starting a company today, there is this feeling you have to do more than the last company, right? And more doesn't necessarily have to mean more features, but you have to approach that problem in a slightly different way. And I love the Pokemon Go example, because for them to make Pokemon come to life, they said, well, we're going to go in the real world, and therefore the byproduct is a lot of these healthy things. I think Peloton is this interesting example as well, too, because historically there's always been that bike you could buy at a sports basement or something like that. But, this company comes along and says, we're going to give you a great bike and create this content that feels a little bit like SoulCycle in your own bedroom or garage or basement. And so I think the incentive for entrepreneurs is, how do you get really creative with the problems that are put in front of us, right? And, it may not be health as your main #1 priority, but it could be a byproduct, right? Like, that's, I think, the lens to look at it.
Yeah. Okay, and Nick, slight variation on the question: how do we get incumbents? How do we get large companies, and why, in specific, like, why does Alphabet care about this? What is the business case to be made?
Yeah, I mean, we're right in the midst of a pretty significant tech backlash, and it's hard to pick up the paper or jump online and not read another article. It seems like, whereas 5 years ago, 10 years ago, there was a lot of positive energy around tech. Now, I feel like we're on the other end of that cycle. And so I do think that companies have greater responsibility thinking about the broader impacts of their products and services. And I think as employees of these organizations, we're certainly spending a lot of time thinking about those issues and sort of corporate responsibility. And so Alphabet's interest is really around sort of accelerating urban innovation for the explicit purpose of improving the quality of life for as many people as possible. And so it's a long process, but it's an opportunity to sort of create a place that sets a good example, and then hopefully sort of open source or share a lot of those ideas so they could be more broadly applied. And so I think, our incentives is really sort of think beyond our core products and services and think about how we can improve people's lives beyond sort of the obvious technology touch points.
So whenever we talk about these kind of technologies, I think it's important then to acknowledge that whether or not they actually are reaching the people that we need to reach when we're talking about problems, especially at this scale. And when we think about the burden of disease, the diseases that we're talking about are obesity, diabetes, heart disease. These are things that disproportionately affect people who are not in this room, not at this conference. Karen, how do we put equity on the table here?
First, something about business model, and then I very much want to talk about equity. The business model for healthcare is obviously a sickness model. The sicker you are, the more money we make. And make no mistake about that. Of the $3.5 trillion we spend in healthcare, we spend about 3.5% of that on public health, so the kinds of things that you're hearing about. So just to give you some sense of the scale of how much money we're investing in sickness as a country compared to investing in even one part of an infrastructure that can support health. You can look at that that data similarly, though, comparing us to our international peers about how much we spend on healthcare compared to social services, which isn't exactly the social determinants, but for some people that's some of their big need. We spend significantly less than our peers on supporting childhood education or education in general, housing, feeding, et cetera. So we have some big policy questions as a country. It's a business model, yes, but there's also the reality is we've got to change the incentive structures coming out of the big mandatory or other federal spending. And there are states that are already looking at it. I actually think it's a tremendous business opportunity for venture capital interested in professionalizing the social services sector, the public health sector, digitizing it, creating a stack of services and a stack of technology opportunities that can really drive that 60% of health, where we've been really focusing on what's driving just about 10% of health and putting all of our money into that space. So I think there's a business opportunity. We just haven't been able to articulate it. And I think the business opportunity will be for everyone. It has to be, because we know from the data that the wider the gaps in health outcomes, the worse everybody's health is. So make no mistake, if you've got people in your community who are not doing well, everybody is affected by that. It's not just the poor people or people of color. So the communities that do best, New York, San Francisco, Birmingham, surprisingly, they've narrowed the gap and raised the mean, and that is by working to create the conditions in which everyone can be healthy. I worry a lot, though, about us creating sexy tools that nudge people to move. I'm wearing one. But if I work on a line in a laundry factory and I'm docked every time I step off that line because I need to go do something, if I can't even go to the bathroom, which causes me to not take my diuretic for my heart failure or for my high blood pressure patient I just talked to, because I'm not allowed to step off the line to go to the bathroom in the middle of my shift, that's just a reality that people are living in. So there's also then probably workforce policy and other kinds of big shift in thinking about how we make health the default. This is, and I don't mean to leave us on a note of this is such a big, audacious challenge. I think it's a really wonderful opportunity, but the more we understand the inputs to health and that all of us, not just the healthcare sector or technology, people working in housing and education and labor, all have an opportunity to think about improving quality of life, and that it's going to be best suited if we find a way to create policies and programs and tools that help everybody.
If you guys don't have anything to chime in on directly, I wanted to go to questions.
That's a good question.
Since we had a few minutes, and there are smart people in the room. This gentleman is confident.
We'll see. My name is Brian Duggan. I'm the founder of a small nonprofit called Citizen Science for Health. And our view is that we're all citizen scientists. We're all conducting health experiments. But I'm also a patient and somebody who participates in clinical trials. And the medical research establishment is broken and is a huge piece of infrastructure that's not delivering breakthrough solutions and isn't tapping all of these new data sources and all these things that people are doing. So how can we change the default there, I guess, is the question I would put to you.
I love this program that you guys do, by the way. I've heard about it. You do international work as well, right? And there's, if I'm not mistaken, but there's some models of this where they're basically learning from community. And this is part of the empowerment shift that's happening, where the traditional institutions are realizing that they don't control and own all the data and knowledge, and that sort of crowdsourcing and opening that up is going to be a better pathway going forward. I think there's one or two interesting things to think about, and I guess we just opened South by Southwest, so maybe I'll be the first person to say blockchain, but not the last, I'm sure. So you know, some big companies like IBM and some smaller academic places like Yale, Harlan-Krumholtz are thinking about how if federated data systems can allow consumers to decide when to opt in or opt out of research studies, when their data can be shared and not, and it gives them more nimbleness to the research opportunity. So layering on top of the frontline work y'all are doing, I think there's some new technology operating systems, if you will, that are allowing, I think, the voice to be heard more clearly, especially even in design. Oh, big line.
I actually come from Europe, and where we have a very different a series of different systems. But the thing that is always on our minds, especially I live in Germany, it's one of those places where we didn't invent pharmaceuticals, but we're very good at it. And the pharmaceutical industry is massively powerful. And it's one of the old industries that has set up those defaults, that has set up the sickness environment so that they can sell more drugs. It's not as simplistic as that, but how do we now move forward against these big vested interests, the food companies, the pharmaceutical companies, who are very keen on making us make the choices that will benefit them? Is Alphabet, Apple, are we strong enough in those areas? Applied interactive technologies, is this something that we can ball together?
Guys, though. Congratulations.
Can we ball these areas together?
So we talked about whether or not we wanted to kind of point the finger, and I mean, there are many villains to go around. I mean, to the extent that the default of civilization is unhealthy, there's an infinite number of villains in civilization. I'm not sure, so I don't know that we want to do too much finger pointing.
No, I just ask, how can we fix those systems? How can we countermand in terms of critical mass?
It's definitely. Well, go ahead.
I can offer a meta point. I think one of the challenges is the amount of marketing dollars that go into the commercial choices, and it's like it's a machine that keeps on feeding itself, and so a lot of things we talked about influencing behaviors to try to tip people into a better place, but the deck is kind of stacked against you because of if you look at like 30-40% of pharmaceutical, maybe even higher, revenue is spent on marketing, and so I think there needs to be a way to. I don't have an answer, but I think there needs to be a counter. So not just creating choices, but you also have to counter the marketing. Yep. And I think that's extremely challenging given the dollars involved.
I feel like you have to steal their market share, right? I mean, like, that's what we all have to do. You have to steal the market share from the pharmaceutical companies, from the unhealthy options. But the only way to steal the market share is to create the alternative. In many ways, right? It's like, how do you treat someone earlier if it's, obesity hits you later on in life, and then you become trapped in their system? How do you get to them sooner? How do you get better food options? But they have a lot more money on the line for keeping what you call, they've created this sickness environment, how you call it.
Hi, I'm Anna Tunkel. I run global partnerships for a global consulting company. I was wondering if you could comment on the recent, kind of the trio partnership that Amazon, JP Morgan, and Berkshire Hathaway announced, and if you think that this is, one of the solutions, if this is the way forward, big companies, actually, as an antidote to the former question, coming together to solve for this crisis, and specifically on those three specific entities and what you think is in store.
So Warren Buffett calls, healthcare the tapeworm of our economy, right? Healthcare prices have increased faster than, I believe, inflation or any other metric that matters. And so you got to see from his and that group of companies' point of view is like, how do you actually reduce your healthcare costs? And between Amazon and Berkshire and JP Morgan, it seems like this collection of a lot of employees, so they can amass that as a perhaps negotiating power, but also a set of very diverse companies. That my hope in that trio is that they come up with solutions that can be borrowed, copied, and repeated across the healthcare system. But it really does come from the growth piece of healthcare expenses.
And I think that's I agree that's the conventional wisdom and probably where they'll start. My hope is that they don't end there, that they just learn more about the existing system and are going to school on it, and that they're then going to think more about some of the strategies that we talked about really understanding where people live, learn, work, and play, and how they behave in those environments, and how they can be supported and nudged, and how we can create peer networks and digital coaching and more transparency of data, and frankly, a new business model that encourages health and not one that benefits from health. There's lots of ways that they'll be able to sell people things. you know, if you know that someone bought tickets to go to a trip to Central America and then you can sell them a travel vaccine visit, that's great, a preemptive approach. On the other hand, you can also do a lot to encourage people to eat healthier, and but just through the online shopping opportunities. But it goes well beyond that. So, yeah, I'm one of the holdouts. I'm having hope that Amazon sees this world of social determinants and understands that clinical excellence and even insurance excellence is only going to get us so far, and that we've got to break free of that and really give people a lot more information in their own hands and houses.
Sir?
Yes, thank you. My name is Clement. Thank you very much for kicking this off so splendidly. And let me give a little perspective on the question that I want to ask. We as a society kind of group together people, the theory is, to protect ourselves from dangers from outside. It could be the animals, then it was the diseases, then it was the other warring tribes, etc. Now we're packed into groups and we live together, and the idea of security is just letting us as a society die in our beds, each individually. Now we've delegated some of the responsibilities for that to the government as a manifestation of us as a society. We select the government to protect us. Now they protect us from the outside threats, like from the foreign nations and stuff. They protect us from the criminals on the inside. They protect us from injustice. And that's why the legal system is not privatized. The police system is not privatized. The army is not private. And the question is, healthcare has become a massive common thing that impacts us all. Like, I participated in a healthcare think tank event a couple of days ago, and I liked the phrase that one of the speakers said, "City is the new smoking." And I really do think that
I'm going to nudge you to a question.
Yes, the question is, but on the other hand, there is a commercial aspect to the healthcare in our country, in here in the United States. So may I ask each of you, do you believe that we should drift towards government-provided massive healthcare, or that you still believe that the commercial and the business-driven healthcare could be the solution because there are advantages to one and the other? Thanks.
I'm just going to note we were trying not to talk about the healthcare system in this talk, but if anybody has a thought.
I'm sorry, I didn't know that.
It's all right.
The 2 seconds. Oh, sorry, go for Karen, and then I'll.
You go.
Oh, I think if more than 60% of the country is covered by the federal government in healthcare, then they are going to be, and I think have to be, a big actor. I always feel like, you know, we all turn 65 and then we're on Medicare, right? Which means then today, technically, we're all Medicare recipients. And I feel like there has to be some way that the federal government thinks about how it spends its Medicare dollars earlier, so it does more of the prevention side and plays a bigger role. And we actually appreciate that the federal government is an actor in our health side of things.
So I'm really glad you raised the question, because it's a great reminder to all of us. Oh, there you are. First of all, thank you for bringing in the sociology, and it's really important that we forget that. We get kind of technical in the healthcare space. It's a reminder to all of us that when we think about health, we do often default to thinking about healthcare. And if we were to do nothing else in the next 10 years in this country, to me, it would be for everyone to understand that at least 60% of your health outcomes is about where you live, learn, work, and play, and how you behave in that system. It is your life. It's not your healthcare. And that clinical excellence is important, and it's where we're pouring all the money, but we are pouring money into something with a stopper out. There is no end in sight. We're going to keep throwing money down that drain. I'm a doctor, I'm sorry to say that. So we've got to understand it, and I think policymakers are getting there, and maybe we need to shift money out of Medicare to pay for health or public health, or maybe we just need to create a new mandatory spending pathway. But your question, I think, has a lot to do, raises for me the role of government in a complex society, especially this one. And the way we've maneuvered it, and what I'd like to see us maneuver it, is we use regulation to protect and support individuals and communities, especially if they cannot protect themselves, so the commons. But we allow a lot of individual freedom, and that's the space where innovation comes up in the private sector. And so we're constantly trying to balance those two things. I haven't been in government at the local and federal level and private sector. I can tell you neither can do it alone, because something will absolutely go awry. So I don't think we can put it all in the hands of government or all in the hands of the private sector. But mostly it's that we have to talk about health, to Thomas's point, which is a broader concept than healthcare.
So I just wanted to I wanted to wrap up, but we talked about not leaving you guys with just kind of ideas, but something a little more concrete. And so if you guys each had 5-10 seconds of a call to action to make, if you have one.
My call to action is, so South by Southwest is actually very, holds a special place in my heart, because 6 years ago when I was attending one of the sessions, Rock Health was announcing that it was starting its incubator, and so that kind of told me that I should throw my hat in the ring and try out and actually build something. And so my charge to everyone in this room is that if you see an opportunity in any of these spaces, in the way that we live, eat, travel, move, live, think about starting something or building something or shaping the company that you're at to kind of play more in that space and think about how the product that you deliver can maybe have some side effects that are in the healthcare side of things. So,
my advice is be aware of the defaults that are placed in front of you and demand better.
Nice. Mine is for you to demand your data. And start with your healthcare system. Make sure you signed up for your portal. If you're a Medicare or a veteran, or you have someone in your family who is, use Blue Button 2.0 to get your claims data. Start to let the institutions, the hierarchy, know that you care about what they know about you and that you want it to be controlled by you.
And I have one, which is simply ask the question, does this have a net impact of health or of ill health? And if we demand that or ask that question of the services and companies we use, we would make progress. I want to thank you, each of you, for being here. I want to thank all of you for deciding to kick off your day here. Thank you.